Okay, today we're going to be talking about the chapter 10 of your book, the respiratory system, the comparative anatomy and physiology found within different species. Learning objectives for today will be to differentiate between internal and external respiration. We'll explain what that means. List the secondary functions of the respiratory system, the components of the upper respiratory tract, and describe their structure and functions, and do the same with the lower respiratory tract. We're going to be talking about the events that occur during inspiration and those that occur during expiration, the muscles that are involved in both inspiration and expiration. We're going to talk about what the terms tidal volume, minute volume, and residual volume mean. And we're going to describe the processes of oxygen and carbon dioxide exchange between the alveoli and the blood. We'll also describe the mechanical and chemical respiratory control systems. So the respiratory system is primary function, obviously, is to bring oxygen into the body and carbon dioxide out of it. The respiratory system works together with the cardiovascular system. Secondary functions of the respiratory system, these are the things you need to remember, are that it helps with voice production or phonation, regulation of body temperature, regulation of acid-base balance, and sense of smell. We'll go through some of these to give you a better understanding of what that means. External respiration is the exchange of oxygen and carbon dioxide between the inhaled air and the blood flowing through the pulmonary capillaries. So you need to think about what that means. Where is that occurring? External respiration occurs in the lungs. Please remember that. Internal respiration, on the other hand, is the exchange of oxygen and carbon dioxide between the blood and the systemic capillaries and all the cells and tissues of the body. So the difference between external and internal respiration is external, not having outside the body, but actually inside the body in the lungs. Internal is in the rest of the body, what's happening at the tissue level. Let's talk about the upper respiratory tract first. These are things that are happening outside of the lungs, outside of the thorax, okay? So it starts with your nostrils, go through the nasal passages, and different species will have different, and even different breeds within species will have different shaped nasal passages. We have the pharynx, which is basically the back of the mouth, and the larynx, which is the start of the trachea. And then we have the trachea, which is one of the tubes that leads into the rest of your body, the other one being the esophagus that's going into the GI tract. So again, let's look at this picture. We've got the nostrils at the front, which the openings for the nostrils are called the nares, and those are the external openings that lead into the nasal passages. The nasal passages are between the nostrils and the pharynx, so this whole section here. When we think about short-faced breeds or brachycephalic breeds, some of the changes that occur with the breeding of these dogs make it a little bit more difficult for them to breathe. One of those actually starts at the nares, and that's where we call them stenotic nares. Now, if you remember from our cardiovascular lecture, we talked about stenotic meaning a narrowing of. So this is a narrow nostril, and there's actually a corrective surgery that we will do in order to open up those stenotic nares. Is fairly commonly done for these breeds. Into the nasal passages, and then of course for short-faced dogs, brachycephalic dogs, they will have shorter nasal passages. In a dog, there are lots of these little turbinates that are all spiraled, and that increases the surface area through which chemicals can interact with the surface and the nervous system, which is why they have such great senses of smell. That's your nasal passages. There is a nasal septum that separates the left and right nasal passage, and then there's hard and soft palates that separate the nasal passages from the mouth. A hard palate is a bone between the mouth, and that's in the nasal passages, and then we have a soft palate back in the back. There's also, so if you see this tan line that comes all the way back. One other change that we will see with short-faced breeds is this will be the same length as it would be in a long-faced breed, but because it's the same length, but their nose starts back here, it actually looks a little bit longer, so it'll actually flop back down here and actually completely cover the trachea. And that's something that sometimes we'll have to do another corrective surgery to remove that excess soft palate. and it traps the epiglottis so the epiglottis doesn't move in the right way. The other thing that can happen, something we cannot correct with short-faced breeds, is they very often have a very narrow trachea for their size. And so we often see these dogs having difficulty breathing even when we correct the nares and the soft palate. So these turbinates, as I said, they're also called nasal conchae. They divide each nasal passage into 3 main passageways, and there are some thin scroll-like bones that are rolled or spiraled that are covered with nasal epithelium, and they occur both dorsally and ventrally. Here's an X-ray of a dog with, you can see these turbinates inside the bone here, and they're very thin bones. This dog actually has some stuff going on. You can see a difference between the left side and the right side of this dog. So there's some sort of disease process going on in that dog. So what's going on here in the secondary characteristic is that we've got dry air entering in the dog's nose, and it's picking up water on the surface of the turbinates, and then the water is deposited back in the nasal cavity. So it's actually humidifying this dry air, so when it comes into the body, it's more humid. This is a cross section of what those nasal turbinates look like, or the nasal conchae look like in the dog, as compared to the cross section of the turbinates in a bird. So the sense of smell in this dog is much greater because of the increased surface area that nasal epithelium has contact with the particles that come in. So birds are also warm-blooded. They do have the same water recycling system as mammals, but they have a different, it evolved independently. It's just a different aspect of it. The nose and nasal passages, so they're lined with pseudo-stratified columnar epithelium. Look at this word. Pseudo means fake or false. Stratified means layers. So it's false layers, okay? So these are columnar as well, so they're all kind of lined up. They sort of look like they're layered, but they're not. That's why they're pseudo-stratified. They have cilia and then mucus. And what the cilia does is it moves particles out of the respiratory tract to keep, it's one of the ways that the respiratory tract keeps clear of debris. And this mucus also traps the particles and tries to keep it out of the body. The mucus is secreted by mucus glands and goblet cells. So we're going to see these goblet cells throughout the body. Just remember that they do produce mucus. So nasal passages function, they warm and humidify and filter out inhaled air. The air is warmed by the blood that is flowing through the blood vessels just beneath the nasal epithelium. Again, we'll go back to this picture, and you can see these blood vessels here, right underneath the epithelium. The air is humidified by mucus and other fluids on the epithelial surface, and it's filtered as it passes through the winding passages produced by the turbinates. Particles do not readily pass through, but become trapped in that mucus layer. Cilia move mucus and trapped foreign material upward toward the pharynx or the mouth, so we can get it cough or sneeze, get it out of our body. Think about if you're working in a really dirty environment. Say you're sweeping in the barn, or you're dusting out a really dusty room in the house. You ever blown your nose afterwards? You can see that the color of your mucus is much different when you've been in a dirty environment, and that's your body doing its work. It's filtering this dirt and debris and the particles out, keeping it out of your lungs. Animals and people have paranasal sinuses. They are little outpouchings of the nasal passages, and they're within the bones of the skull. And they're ciliated, meaning they have those little hairs on the lining of it to try to keep things out of our internal body system. Most animals have 2 frontal sinuses and 2 maxillary sinus within the frontal and maxillary bones. So these paranasal sinuses are the frontal and the maxillary sinus. If you've ever had a sinus headache before, and there's that you just have this aching between your eyes, that's in your frontal sinus. And animals have the same thing, and they can also get sinus infections. Here's the pharynx. Remember, I talked about this problem with elongated soft palates in bulldogs and other brachycephalic dogs. Here's an actual picture rendition of it. You can see how this soft palate comes all the way back and touches and overlaps the epiglottis. So it completely closes off that trachea, even when they're trying to breathe. So removing that redundant soft palate tissue can help them open up their airway and breathe a little bit better. The pharynx is the common passageway for the respiratory and the digestive systems. So the esophagus opens up into the pharynx, and the trachea opens up into the pharynx. The soft palate divides that pharynx into the dorsal nasal cavity, which is the respiratory passageway, and the ventral oropharynx. So dorsal nasopharynx, ventral oropharynx, which is the digestive passageway. The caudal end of the pharynx opens dorsally into the esophagus and ventrally into the larynx. There are reflexes that control the muscles around the pharynx. Larynx and pharynx work together to prevent swallowing from interfering with breathing and vice versa. So when you swallow, breathing stops and the opening into the larynx is covered, and material to be swallowed moves to the rear of the pharynx. The esophagus opens up. After swallowing, the larynx is reopened and breathing resumes. I'm going to play this little video here for you, which actually is unavailable. I will find that, but there is a video that does show the process of swallowing that has just been lost to me. The larynx is a short, irregular tube connecting the pharynx with the trachea, and it's composed of segments of cartilage that are connected to each other and the surrounding tissues by muscles. It's supported in place by tiny little bones together that make the hyoid bone. There are some cartilage components of the larynx as well. That's the epiglottis, which is that triangular tissue that covers the trachea when we swallow. There are arytenoid cartilage, which is on either side of the epiglottis and the trachea, and that creates the arytenoid cartilages are the goalposts that we look for when we're actually intubating an animal. The thyroid cartilage and the cricoid cartilage are also a part of the larynx. The epiglottis is a single leaf-shaped cartilage. It projects forward from the ventral portion of the larynx, and during swallowing, the epiglottis is pulled back to cover the opening of the larynx and the trachea. Arytenoid cartilages are paired, and the attachment is the site of the vocal cords. So if anything damages those arytenoid cartilages, we're going to hear some different sounds through those vocal cords. Muscles adjust the tension of the vocal cords by moving the cartilages. Arytenoid cartilage and the vocal cords form the boundaries of the glottis. And the glottis is not a structure in and of itself, it's a hole. The glottis is a hole into the trachea, and it is surrounded by the arytenoid cartilage and the vocal cords. I'm going to show you a picture of this. This is what you would see if you opened a dog's mouth and they were either not breathing or they were swallowing. This epiglottis would be covering up the trachea. So you can't see the hole in the trachea. It's actually touching the soft palate, which is up here. Down here is the tongue. Now, when we pull that epiglottis down, or we pull the tongue down enough that it pulls the epiglottis down, now we can see the arytenoid cartilage on either side, and those are attached to the vocal cords. And in that center, that black space there, that is the glottis. That's the opening into the trachea. Voice production happens with the vocal cords. There are two connective tissue bands that are attached to the arytenoid cartilage. This is looking at the animal in the other direction, so they're lying on their back. And this is the tongue. Here's the epiglottis. Here are the vocal cords, and here are our vestibular folds or arytenoid cartilage. It's stretched across the lumen of the larynx parallel to each other, so they're parallel, and then they vibrate as air passes through them. So if you think of a rubber band that you pluck, or a guitar string that you pluck and you watch it vibrate, and it makes a sound as it vibrates, and that's what the vocal cords do. The muscles are attached to the arytenoid cartilage and control the tension of the vocal cords. With complete relaxation, that opens the glottis wide. We don't hear anything. If we lessen the tension, it produces lower pitch sounds, and you tighten the tension, it produces higher pitch sounds. You get the same effect with a rubber band. As you stretch the rubber band tighter, you get a higher pitch, and as you loosen it and relax it, you get a lower pitch. So the function of the larynx is to prevent foreign material from being inhaled. It's a good thing. During swallowing, the muscle contractions pull the larynx forward and fold the epiglottis back over its opening. It also controls airflow to and from the lungs. There are some small adjustments in the size of the glottis that aid the movement of air. Think about when you're swallowing. Have you ever swallowed something that feels like it's going down the wrong tube? That's something that you cough back up, and that's a normal reflex to cough that stuff back up so it doesn't get into your lungs. Once it gets into your lungs, it can create a lot of problems. That is called aspiration pneumonia, when your larynx isn't functioning correctly and you are trying to swallow something, or with animals that may be regurgitating or vomiting and they breathe back at the same time, might get some of this stuff back down in their lungs, causes an aspiration pneumonia, and that is very difficult to treat. Trachea. The trachea is a short, wide tube that extends from the larynx into the thorax. And we say it's short and wide, but if we were talking about a giraffe, we would think that it's a little bit longer, and of course it's longer depending on the species. It divides, the trachea is one tube that goes down into the chest and divides into two main bronchi that enter the right and the left lungs. That's called the bifurcation of the trachea. It's composed of fibrous tissue and smooth muscle, which is held open by hyaline cartilage rings. Hyaline is a building block of cartilage. It's making these cartilaginous rings that make up the trachea. And this trachea is also lined with ciliated epithelium, which again helps to move particles out of the lungs. In most cases, the trachea is a C-shaped ring of hyaline cartilage. Birds have a solid ring of cartilage. And there is tracheal smooth muscle where the C is not completely closed. There is an open part of the tracheal ring, and those face dorsally toward the spine, so there's no soft spot facing outward in the animal. There is a gap between those edges, and that's bridged by the smooth muscle there. In the lower respiratory tract, this is anything beyond the trachea. The bronchi, which branch further into bronchioles, which go into alveolar ducts, which are what looks like these little grapes here. They're just sacs that are enclosed by capillaries. These alveolar ducts are smaller than the bronchioles, and they lead into these alveoli here. The bronchial tree, each bronchus divides into smaller bronchi, which divide into even smaller bronchi, and then into tiny bronchioles, which then go into the alveolar ducts. So if you look outside and you look at a tree and you look at the branches divide until you get to teeny tiny little twigs, that's kind of what we're looking at when we're looking into the lungs. The alveolar ducts end in those groups of alveoli, which are bunched like grapes. They're grouped like grapes, and we call those alveolar sacs, which are groups of alveoli. And what controls this? The autonomic nervous system, which is also, we can think of it as the automatic nervous system. It's an involuntary system. Your body just does it. It controls those smooth muscle fibers in the wall of the bronchial tree. With bronchodilation, the smooth muscle relaxes, and that aids the respiratory effort during intense physical activity. So bronchodilation opens up those vessels, allows air to move freely into the lungs. With bronchoconstriction, the bronchial smooth muscle partially contracts, which reduces the size of the air passageway. Irritants in inhaled air can actually cause bronchoconstriction, and it will actually help us to move those irritants out of the system by making those bronchi a little bit smaller. It helps us to move air more forcefully out of the system. This is an example of an alveoli. Sorry about that. And it is the site of external respiration. Remember, we talked about external respiration being where oxygen is exchanged for carbon dioxide, and that happens within the lungs. We can think of an alveoli kind of looking like this. It's a tiny, thin-walled sac of simple squamous epithelium. So it's almost glass-like. It's very transparent. And it is surrounded by networks of capillaries, kind of like this macrame structure with a glass ball inside. This is lined with a fluid that contains surfactant. Now, surfactant develops in the fetus just before the fetus is born. If they are born prematurely, they don't have surfactant. Without surfactant, it is difficult for them to do the exchange of oxygen and carbon dioxide, and that's why premature babies often have to be kept within a chamber of oxygen and given oxygen so that they can maintain oxygenation of the tissues. Each lung has a base, an apex, and a convex lateral surface. The base is in the caudal part of the thoracic cavity, so towards the abdomen, and it lies directly on the cranial surface of the diaphragm. The apex lies in the cranial portion of the thoracic cavity. And the convex lateral surface, obviously on the outer lateral walls. So it's the inner surface of the thoracic wall. There is in between the left and right has the mediastinum. That's just the area between the lungs, and that area contains the trachea, the esophagus, the heart, lymph nodes, vessels, and nerves. So lungs are divided into lobes in most species, but the pattern varies with each species. The lobes are distinguished by the major branches of the bronchi. There is a hilus, which is a small, well-defined area on the medial side of the lung. So on the inside, where the mediastinum is, that hilus is where the air, blood, lymph, and nerves enter and leave the lungs. So it's at one point, and if anything happens at that hilus, it can really change what's happening throughout the lungs, actually throughout the heart as well. Pulmonary circulation. So what happens? Deoxygenated blood enters the lungs from the right ventricle of the heart through the pulmonary artery. That pulmonary artery will split into the left and right pulmonary arteries, and they enter the two sides of the lungs. Those pulmonary arterioles, as they get smaller and branch off, enter capillary networks around the alveoli. Oxygenated blood returns after it goes through past the alveoli, and we have the external respiration occurring. Then that oxygenated blood returns to the left side of the heart in the pulmonary veins. The thoracic cavity is bound by thoracic vertebrae dorsally, ribs and intercostal muscles laterally, and the sternum ventrally. That mediastinum that we talked about is the area between the lungs that contains the heart, trachea, esophagus, blood vessels, nerves, and lymphatic structures. Pleura is a thin membrane that lines the thoracic cavity and covers organs and structures in the thorax. The visceral layer covers thoracic organs and structures. The parietal layer lines the cavity. So visceral covers the organs, parietal lines the cavity. And there is a space between the two pleural layers that is filled with a very small amount of pleural fluid, so it allows those surfaces of the organs to kind of glide smoothly and slide smoothly along the lining of the thorax during breathing, so there's no roughness. Now, if that pleura gets inflamed at all, or we lose or gain fluid in there, then that's going to cause some problems with breathing. Inflammation of the pleura is called pleuritis. And if you have an infection or inflammation within your chest, between the linings of the lung and the body wall, that is called pleurisy. And it is actually very, very painful. Feels like ground glass, just grinding on each other every time you take a breath. The diaphragm is that thin, dome-shaped skeletal muscle sheet. It forms the caudal boundary of the thorax, and it's an important respiratory muscle. When it contracts, it flattens. So when you see this picture here, it's in a dome shape. That's actually the diaphragm relaxed. When it contracts, it pulls down and enlarges the volume of the thorax, which aids in inspiration. Pressure within the thorax is negative with respect to atmospheric pressure. So that negative space allows those lungs to expand. So it pulls the lungs tight out against the thoracic wall. The lungs follow passively as movements of the thoracic wall and diaphragm alternately enlarge and reduce the volume of the thorax. Negative intrathoracic pressure helps draw blood through the veins and into the atria. Let's put it a different way. If you have ever opened a soda pop can, when you open up the soda, you hear gas escaping. That's because the pressure within the soda it's under positive pressure. Now, the opposite occurs when we open up the chest. When we open up the chest, it's under negative pressure, so air rushes in. You'll hear the same sound. You'll hear a psh, but it is air rushing into the chest. And when air rushes into that chest, it will compress those fragile lungs, and that can be a problem. Inspiration is the process of drawing air into the lungs, or inhalation, and it results from enlargement of the volume of the thoracic cavity by inspiratory muscles. The main inspiratory muscles are the diaphragm and the external intercostal muscles. These are the muscles between the external portion of the intercostal spaces, or between the ribs. So if you can feel between your ribs, you can feel the space, and the first thing that you will feel there beyond your skin and your subcutaneous tissue will be your external intercostal muscles. When you breathe in, you can feel those external intercostal muscles contracting, and that helps to draw out the chest cavity and open up the lungs so that you draw air into it. So here is inspiration. Here are the external intercostal muscles, and as they contract, they open up the lungs, and the diaphragm is part of that as well. With expiration, it's the internal intercostals as well as your abdominal muscles. The rectus abdominis, the external oblique, and the internal oblique. So it's the process of pushing air out of the lungs, and it decreases the size of the thoracic cavity. Internal intercostal muscles and the abdominal muscles are the main expiratory muscles. The internal intercostals are located between the ribs deep to the external intercostal muscles. And contraction of those abdominal muscles also pushes the abdominal organs against the diaphragm, so it pushes the diaphragm back into its full dome shape, which pushes the air out of the lungs. Volumes, respiratory volumes. We will refer to tidal volume, minute volume, and residual volume when we're talking about animals with lung disease. Tidal volume is the volume of air inspired and expired during one breath, and it varies according to the body's needs. If you are racing, you're going to bring in a lot of air, and you're going to breathe out a lot of air. If you are sitting there quietly, you don't need to bring in a lot of air and push out a lot of air. So your tidal volume will change based on what your need is. The minute volume is just the volume of air inspired and expired during 1 minute of breathing, and it has to do with your breathing rate and your tidal volume. The residual volume is important when we're talking about animals with lung disease, because it's the volume of air that remains in the lungs after maximum expiration. If you've known anybody, or you yourself have asthma, asthma will will increase the amount of residual volume that you have, because your lungs aren't flexible enough to push the air out. And so what happens is you end up with a lot of residual volume, and that decreases the amount of oxygen you can take in the next breath, which makes it harder and harder to breathe. If you've had asthma, you know that they test that residual volume, and they ask you to get rid of as much air as you possibly can, and then breathe out. And so that is one way to test the residual volume. Alveolar gas exchange. So what happens at the very minutest level? It's just the simple diffusion of gas molecules according to concentration gradients. So it's an osmosis thing. The oxygen will diffuse from the alveolar air into the blood of the alveolar capillary, just because there's a lot of oxygen in the air versus the amount of oxygen that is left in the blood. And carbon dioxide does the opposite. It diffuses from the blood where it's plentiful, coming from the veins of the body back into the alveolus, and then out through with the expired air. Partial pressure of gases. This is something that's often measured when we're doing arterial blast blood gases, and it's the pressure of each individual gas within a mixture of gases. So for an example, atmospheric air has 21% oxygen. Total atmospheric pressure is about 760 millimeters of mercury. So our partial pressure of oxygen in the atmosphere is 21% times 760 millimeters of mercury, which gives me about 21% of 760 is about 159.6 millimeters of mercury. The partial pressures of oxygen and carbon dioxide in the blood of the alveolar capillaries is determined by the partial pressures of oxygen and carbon dioxide in alveolar air. So it's what helps to drive the diffusion of oxygen and the exchange of oxygen and carbon dioxide. How does this all work? Well, there's an area in the medulla oblongata of the brainstem. It's at the very base of your brain, and it controls the respiratory muscle contractions. It also directs the timing and strength of the contractions. There are individual control centers that monitor and incite inspiration, expiration, and breath holding, and these can be consciously controlled for brief periods. At some point, you may have tried this as a child, you will have to take a breath. You can hold your breath for as long as you can, turn purple if you want to, but at some point you're going to pass out, your respiratory center is going to take control. The mechanical control system of the respiratory system, there are stretch receptors in the lungs that set limits on routine resting, inspiration, and expiration. So you take in a breath, and you stretch your lungs, and then there's a limit, and you breathe out again. The respiratory center will send out nerve impulses when the lungs inflate to a certain point. That stops the muscle contractions that produce inspiration and starts the contractions to produce expiration. There's another set of nerve impulses sent when the lungs deflate sufficiently, which stops expiration and starts the process of inspiration. Aren't you glad you don't even have to think about it? It's just something that your body is used to doing. There is also a chemical control system which will adjust the normal rhythmic breathing, and this has to do with the acid-base balance of the blood. So there's a pattern that's produced by the mechanical control system, but then there's chemical receptors in the carotid artery and aorta, which monitor blood carbon dioxide, pH, and oxygen. The pH is partially determined by carbon dioxide. We'll talk about this a little bit more detail later, but if we have a low pH, or carbon dioxide, it is too high in our body, and so our body will increase it will hyperventilate in order to get that carbon dioxide out of the body. The blood level of CO2, blood pH, they're linked, just like I said. The increased CO2 in the blood and decreased blood pH triggers the respiratory center to increase rate and depth of respiration. So if you see an animal hyperventilating, you'll want to test the blood pH because it's likely that they're what we call acidotic. Decreased CO2 in the blood increases blood pH or makes it more basic. Increased blood pH level will then trigger respiratory center to decrease the rate and depth of respiration. So they'll slow the rate and they'll decrease the depth of respiration. So they're keeping carbon dioxide in the body. Hypoxia is a decrease in blood oxygen level. Slight hypoxia will trigger the respiratory center to increase the rate and depth of breathing. But if it's severe hypoxia, the neurons of the respiratory center can become so depressed that adequate nerve impulses cannot be sent to the respiratory muscles, and that will cause breathing to decrease or stop completely. So it's important when we're monitoring animals, especially under anesthesia, that we keep an eye on that blood oxygen level. And if it's starting to decrease, we may need to step in because their respiratory center may have been depressed by the medications that we're using. Birds are really different. They have lungs and they have air sacs. So not only do we have to worry about air moving through the lungs, we also have to worry about air moving through these air sacs. These air sacs are really interesting. They're very, very thin, but they're not super flexible. They're held in place. They do help the bird to be a little bit lighter. So especially if they're birds that fly, they're better able to fly because they're lighter. So there are 9 air sacs in most birds. There's one intraclavicular, so it's in between the shoulders or the clavicles of the bird. There are 2 cervical in the neck. It's 2 cervical sacs. There are 2 anterior thoracic, so in the front part of the chest. There are 2 posterior thoracic in the back part of the chest, and 2 abdominal sacs. I'm going to go through how these animals breathe. They actually breathe in 2 breaths. It actually takes 2 breaths to move the air all the way through the system. And we'll go through that a little bit later. Other reptiles have a kind of a different lung system. They're very long. In snakes, for instance, and because they have a different setup for the movement of their blood, it also changes the way their lung capillaries are made up. So they have a lot more mixing of the blood before it gets to the lungs. So if you have any questions about how the lungs, the respiratory system is set up, please let me know. We're going to get into respiratory diseases a little bit and talk about what we can expect when we see animals sick from respiratory diseases.